Now, coming to the skull is basically all the bones. So, the skull has the bone which covers the frontal lobe, which is called as the frontal bone. Now, generally, there is a thin suture at birth, which is called as the sagittal suture, which sort of fuses later in life. Also, there is a fontanelle or opening, the anterior the anterior fontanelle, which is a opening in the frontal bone. Then there is the coronal suture, which are sutures between the frontal and the parietal bone. Then the glabella is the area between the two eyebrows. Then there is the supraorbital foramen, a tiny narrow opening where the arteries drain from. Then the supraorbital margin is the upper margin of the eye. The sphenoid bone, which is a bone which has wings, the greater wing and the lesser wing, which forms part of the base of the skull. The temporal bone, which is this bone, okay, the ethmoidal bone, which is bone present in the medial side of the orbital wall. The nasal bone, which is a bone of the nose, and the palatine bones, which forms part of the palate. The nasal septum is formed by a perpendicular plate of ethmoid bone and the vomer bone. The maxilla is the bone which forms the upper jaw, and these are the alveolar processes of the maxilla which form the teeth. The mental foramen are openings in the mandible which transmit nerves, and the mandible is basically the jawbone. Then the alveolar process of the mandible is like the alveolar process of the maxilla, which are basically sockets of the teeth. And the inferior nasal concha, so there are basically some conchae, basically outpouchings or protuberances which are present and which are called as the inferior, the middle, and the superior, and these are form the part of the nasal cavity, and so those are called as conchae. Then the infraorbital foramen is an opening in the inferior part of the orbit and transmits some nerves. The zygomatic bone is this bone. I made a mistake here. The temporal bone is this bone here, the dark purple color bone, and this is the zygomatic bone, the dark green in color. So that is the zygomatic bone. Then the inferior orbital fissure is a tiny fissure which is seen posterior to the orbit cavity, and that transmits the inferior orbital nerve and some vessels. The lacrimal bone is the bone which lies adjacent to the lacrimal duct, and then the superior orbital fissure is a fissure in the above the optic foramen or the optic canal, where through which the optic nerve transmits. So this is the optic canal, and the orbit is basically this entire round structure. So these are all the things which we need to know as far as the skull anatomy is concerned.